confuse the common cold with a deadly sickness, and this isn't the first time this virus has been around. Ciaramitaro tells us more about this bug.
A deadly influenza virus is spreading throughout the country, but what makes this flu season more frightening than past seasons? It's affecting the young and otherwise healthy adults. Dr. Nasir Hussein, an infection control doctor at Henry Ford Hospital, says the two most common ways to spread the flu virus are through coughing and touch.
Cough is probably the most efficient way of spread for this. And folks who have a cough, it spreads into the air, and that air is then spread out into the surrounding areas and people breathe that. So they're not really aware that the air around them might be contaminated. Obviously, contact, meaning hands when placed on surfaces that are in public areas, they remain contaminated also.
The most effective and easiest way to prevent spreading the flu is by using common hygiene practice.
If you have a cough, try to contain your cough either by using some tissue paper or mask, or if you have to cough and you don't have those available, you could cough with your bent arm in the crease of the elbow. That's good etiquette. Obviously, getting the flu shot is very effective. That's a medical treatment. So I think, and if you're sick, try not to go out in public places. These are good ways to prevent spreading the virus.
The H1N1 virus has had a large impact on the younger working class due to the lack of younger adults receiving vaccinations. Sadly, this demographic has made up for at least a dozen flu-reported deaths this year alone.
Some of the people, the younger community, the younger members of the community have not quite caught up to getting the vaccine. So they have had no exposure to this strain of H1N1. And we do see this year, the age group that's been affected the most are the young working people, young healthy men and women.
Doctors are urging everyone to receive the flu vaccination sooner rather than later, saying the sickest patients either didn't receive the flu shot or were pre-exposed to the virus. For Shelby This Week, I'm Ciaramitaro.